Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Today we are wrapping up our studies of the 2019 ICD-10-CM coding guidelines on Chapter 1, AIDS. So my previous, 4 or 5 videos on AIDS all come into summation today with this last video on AIDS coding. So we are down to Chapter 1H. So let's look at the guideline first and then we'll further discuss. All right, guideline says we're down to H. H says, encounter for testing for HIV. If a patient is being seen to determine his or her HIV status, use code Z11.4, encounter for screening for human immunodeficiency virus HIV. Use additional codes for any associated high-risk behavior. If a patient with signs or symptoms is being seen for HIV testing, code the signs and symptoms. An additional counseling code, Z71.7, human immunodeficiency virus HIV counseling, may be used if counseling is provided during the encounter for the test. When the patient returns to be informed of his or her HIV test results and the test results is negative, use code Z71.7, human immunodeficiency virus HIV counseling. And then if the results are positive, see the previous guidelines and assign codes as appropriate. All right, so what's going on here? Exactly what we've covered up to this point. So if they're coming in, if it's an encounter for a test, they're not experiencing any symptoms for you to code. They're just coming in for testing. So it's an encounter for, if you look up main term, encounter for, then you'll find the encounter for screening for HIV, Z11.4. Now if the patient does have signs or symptoms, and they're questioning whether or not it's AIDS, then the reason they're coming in is for the signs or the symptoms, right? So then you'd code those signs or symptoms first. And then if they're wanting to determine whether or not they have AIDS, then evidently they need some counseling to go along with that to justify the AIDS test, because they know they might have experienced some behavior that could cause AIDS, or their circumstances. I won't say some bad behavior. It's just behavior that may have led to a positive AIDS test. Okay, and when the patient, once they come in for that, so that's your diagnosis there, whether it's signs or symptoms or just to be tested. But when they come back to get the results of their test, if it's negative, do the code the Z71.7 HIV counseling, because again, they're coming in for counseling on the results of their HIV test. But if it's positive, then refer to my previous video where I discussed when it's full-blown AIDS with symptoms, B20. When it's just a positive test, Z21. Or if it's inconclusive, R75. So again, guys, to finish out this unit on AIDS, I wanted to give you some examples to code and then give you the answers to go along with it. So just go back and view all of my videos on AIDS that I've done in the last week, just in this previous last week. And then based on those videos, you should be able to answer these 5 questions that I've prepared for you to code. And then on the end, I'll give you the answers. Okay, guys, so here are your questions. Number 1, candidiasis of the esophagus, opportunistic, secondary to AIDS. So I'm telling you there, this patient has AIDS, and this condition they're experiencing now is secondary to AIDS. So that lets you know what your principal diagnoses should be in that first one. 2, positive HIV test in a patient who is asymptomatic presents no related symptoms, and has no history of HIV infection. Cut, dry, to the point. You guys should know that based on my videos. 3, acute lymphadenitis due to HIV infection. So that tells you right there what your first code should be, because this patient is experiencing a symptom of HIV. So they are positive for HIV, and they've also got that symptom. So you know what that first principal diagnosis should be. 4, background retinopathy due to AIDS. Again, due to AIDS. And then number 5, inconclusive HIV test. All right. So hopefully you've had time to write each one of these down. Candidiasis of esophagus, opportunistic, secondary to AIDS. Number 2, positive HIV test in patient who is asymptomatic, presents no related symptoms, and has no history of HIV infection. 3, acute lymphadenitis due to HIV infection. 4, background retinopathy due to AIDS. And 5, inconclusive HIV test. Stop the video, pause it, do whatever you need to do, because I'm getting ready to give you the answers. Number 1, B20 and B37.81. Number 2, Z21. Number 3, B20 and L04.9. Number 4, B20 and H35.00. And number 5, R75. Okay guys, that's it on our studies of AIDS. Go back and view all of my previous videos in the past week on AIDS, and you should have no problem coding AIDS. Thanks guys, I'll see you in the next one.